Welcome to Texas Urogynecology and Laser Surgery Center. This is Dr. Richard Farnam. So we have Nubia Media here today. She's going to help us talk about surgery and pre-surgical anxiety and her experience with surgery and what we can do about that. So welcome. Thank you for coming.
Oh, thank you for having me. So my name is Nubia Media. I had surgery a few years back, and it was probably very scary. And I had a lot of questions before my procedure, and so I hope that you guys find this helpful.
We're going to go down the list of most Googled questions, most searched questions, patient questions for surgery anxiety, things they're concerned about, what they want to know, and we'll get those asked and answered for you. I'm your host, Richard Farnam. Welcome to the Dr. Rich vlog, where we answer all of your questions as it relates to medicine and surgery. If you're new, please hit the subscribe button so you don't miss any valuable content. So tell me, what do you remember about the surgery? What were the things that were the biggest questions on your mind? Things that you were either afraid of or just didn't know about and wanted more information?
I guess one of the things that I was worried about a lot was that I was scared of the anesthesia. That was probably one of my biggest ones. I was scared of scarring, that I was gonna have scars from the surgery and I was never gonna be able to wear a bikini again. I think for a lot of us women, we can relate to that. I was also worried that, what if something goes wrong, or what if they find something wrong, but I think the fact that I had surgery for endometriosis, that's kind of what pushed me to face my fears and get the surgery.
Yeah. So what things happened for you? What research did you do, or what resources were available that kind of helped you answer your questions?
Well, what I did is first, I guess I went through a lot of OBs before Dr. Farnam. And unfortunately, I had already had a lot of complaints about my period and how I would get really bad periods. And Dr. Farnam, from the very first time I came to see him, I told him about it, and within a minute of him just testing me, he said, "Oh, you have endometriosis." And so for me, even though I was more scared of the surgery, it was more of the fact that I was able to talk to him about my fears and really just tell you what I was scared of. And I really, what I did is I just made an appointment, like for my clear appointment before surgery, and I asked you all the questions, all the questions that could possibly go wrong, and it was very assuring for me to get that information from you. So thank you before the surgery.
And that's what you'd recommend for other people, is just take a list of questions, put all your concerns, and just address those with your doctor.
Yeah, and I mean, because no one's going to be able to answer your questions better than the person who's going to operate on you, because no one knows the complications better than the person doing the job.
And so having concerns about all types of different complications, was that something that you feel that you were bothered by more than you should have been, that everything went well? Did you have complications? Were there problems? And you'd mentioned scarring. How was your feeling about that, looking back now?
Well, I could still wear a bikini. I had very minimal scarring. I don't have any, to be honest. I was very lucky. It was very fast. I had surgery I think it was at 7:30 in the morning, and I was home by 9 o'clock. So it was very, very minimal. I got here, the nurses were very nice. They did my surgery, and after that, it was just stay home and relax and eat a lot of ice cream and just relax. That's all you can do. I think the part that I probably had most, that I didn't enjoy after surgery was feeling the bloated feeling. I felt like I was 4 months pregnant because my stomach was bloated. I wasn't able to go to the bathroom for about a week, so that was very very tough, but it was well worth it.
And were there any things as far as that concern? Because I would say that's a very common issue that happens after surgery, and it's a result of the medicines that are required to do the surgery, the anesthetic medications, a combination of that and during surgery, there is some manipulation of the gut, of the bowel, and it takes time. It takes time for the bowel to kind of get back to its normal function. And I mean, for some people it's a week, for some people it's 3 months. And perhaps, and that's frankly why we're doing this, is to find out what concerns people have, questions. And so what would your advice be for someone who's about to have surgery as it relates to that? What would you prepare them for, or any recommendations that you would have, anything that you found helpful?
Well, one of the things that I guess I would recommend you all, so you don't go through the same stuff I went through, is that when before my surgery, I asked Dr. Farnam, he gave me a prescription, and he said, you need to go get these medications. And on top of that, I suffer from nausea when it comes to anesthesia. So I get really bad nausea. So one of the things I told Dr. Farnam was, please give me something for the nausea after the surgery to make sure that I don't throw up and have to stay at the hospital overnight for that, you know. Another thing was that I didn't listen when he gave me the prescription for the stool softener, and I regretted that. So my advice to you all is get your medications, get the list of medications that the doctor gives you, so you can already have them in hand, because you won't have time to do it before, and you won't want your family to leave your site to have to go to the pharmacy and get that for you. So definitely listen to your doctor.
So do what we say. Yeah. Well, that's great, and I'm sure many people will find that helpful. So we're going to switch gears a little bit. We're going to go down the list of most Googled questions, most searched questions, patient questions for surgery anxiety, things they're concerned about, what they want to know, and we'll get those asked and answered for you. All right, so now we're going to go through a list of commonly asked questions. Take it away.
All right, so one of the first questions is, how can I reduce my anxiety before the surgery?
So pre-surgery anxiety, I think, mainly comes from not knowing what's going to happen. So the single word answer to that is knowledge. And so what we'll be able to do as we go forward is talk about all of the different events that are going to happen as it leads up to surgery, what's going to happen during the surgery, and then your follow-up. And stay tuned to the end, because that's going to be where we kind of break it down step by step.
I know that when I had my surgery, you came and you saw me right before the surgery.
Yes.
But is that a normal occurrence for most providers when you do have a surgery? Do they come see you before?
Yeah, I think that's a big concern in a lot of people's minds, is they're at the peak of their anxiety right before they go back. Am I going to see my doctor? So I would say almost exclusively the answer is yes. Not just because it's the right thing to do and the patient needs you at that time.
Yeah.
They need you to kind of give them that comfort and confidence. But also just the informed consent needs to be reviewed, and there's a system of checks and balances, a process whereby I can't say eliminate, but we really minimize wrong-sided surgery, wrong surgeries, and that process involves making sure that the doctor sees the patient right before, and then actually even a surgical timeout before actually any kind of incision is made.
Okay, great. And I know this is a question we don't have to ask, especially for us that are not morning people. Why is it so early?
Yes, why does surgery happen so early? So, if you're a night owl, this is going to be rough.
It's not good.
But if you're part of the 5 a.m. club, you're going to be there ready to go. Yes, so we want to make the most out of our day, just like anything else. I mean, I think most people are productive in the morning before the day gets going.
Yeah.
And so we want to get the most out of it. So, and we can kind of control things better before interruptions start happening later on in the day.
Okay.
And so we typically start 6:30, 7, 7:30, 8, sometime early.
So how come I have to wait for hours before my surgery starts?
Because we like to punish you. No. So I would think of it like an airline, really.
Yeah.
There are a lot of moving parts. This is serious business, so we can't kind of wing it. We have to have a system of checks and balances in place We have to have multiple different checklists, and everything has to synchronize from every specialty. We also have to accommodate in the event of the unforeseen. Maybe we have to have a last-minute change in the surgery schedule. And so it is admittedly an inconvenience to have to be there waiting, for an hour, maybe 2 hours, maybe 3 hours before your surgery. Surgery is like a box of chocolates. You never know what you're going to find. So once you're in there, you may plan on doing a 1 hour hysterectomy, and then you find out there's endometriosis, you find out there's scarring, you find out there's, a cyst or something else going on that requires your attention. And, it takes as long as it takes. So if you're the second, third, fourth case of the day, and we've had some unexpected happenings, just be assured that when it's your time at bat, right, you're going to get that same careful care and attention that the person that is annoying you, that they got, right? So, but it's part of a process, and at the end of the day, it's probably a minor inconvenience.
So be the first one.
Be the first case of the day.
And why does everybody keep asking us the same questions? It's like you walk in and everybody keeps asking you the same questions over and over. So why?
Right. It's like you're the fourth person to ask my name. Right?
Yes. My date of birth.
Yes. And then now I'm questioning: do I know my own name or date of birth? Yes. So again, it's I would think of it like the airlines, where you're going to have somebody checking every single button, every single system, everything that may seem inane or unimportant. We just have to make sure that everybody's aligned, okay? And if something falls out of alignment, another way to think of it is, layers or stacks of Swiss cheese, right? So you have one layer here and another layer, and the more layers you get, the less likely it is there's going to be able to a hole that lines up on all of the layers. Right? The stakes are high, so just like, an airline, if something goes wrong, the stakes are very high. So we want to afford every possibility to get it absolutely right every time. And, it may seem unnecessarily time consuming, and it may seem boring and unnecessary, but there is a method to the madness. The reasons that the systems are in place. Every individual care member on your team, the anesthesiologist, the nurse, the surgeon, and every other care member has to make sure that they have their own information and understanding of the procedure, and that it aligns with everybody else.
Well, that's very comforting. Thank you. And what is the process from start to finish?
Yeah, so essentially, you're going to start with you making the decision with your doctor to proceed with a surgery. And of course, there's going to be a conversation that occurred prior to that, talking about alternatives, medical alternatives, maybe non-pharmacologic alternatives, and that you've ultimately decided to have surgery. So we're going to go over in a step-by-step fashion all of that to give everybody the ultimate blueprint, the ultimate timetable for surgery, and answer all of your questions. So stay tuned to the end.
Great. So I was very, very impressed with scarring, because shortly after I was able to go on my trip and wear my two-piece. But is that normal? I mean, is that a common occurrence?
Yeah, so I'll take the credit, but no, largely most of that is just your ability, your body's ability to heal. So scarring and healing, there is some elements of that we can influence with the size of the scar, the way that we close the wound, but most of it comes down to the patient's own ability to heal with or without a scar. What I can say to that end is that if you have the option of having a big open C-section or a vertical incision versus doing a laparoscopic or robotic surgery, you would probably, if the scarring is a concern, you'd probably want to seek out an experienced provider who has a lot of experience doing those types of surgeries.
Yeah. So, and this is a scary question for me, but what kind of anesthesia are you going to use? Because there's people that are sensitive to that.
Yeah, so nausea is really going to be one of the conundrums of the modern conundrums of overgoing anesthesia. Fortunately, the medicines and the experience level of the providers available today really make the anesthesia experience extremely, extremely tolerable, with very, very minimal risk of severe complications or death. And that has allowed for us to do more and more elective surgery safely, and it's allowed even for cosmetic surgeries to be done very, very safely. So there are different types of anesthesia. You can deliver anesthesia to the entire body and put somebody to sleep, okay, general anesthesia. And for major surgeries, most major surgeries, that's how, all robotic surgeries, that's how surgery is going to be done. Now, that process involves first giving medicine intravenously in combination with an inhaled anesthetic. And so you're well asleep prior to the anesthesiologist performing an intubation or a mask to breathe for you during the surgery. So not only are you well asleep before that process happens, you are also given medicines that are amnestics. So, you probably won't even remember rolling into the operating room at that time.
Oh, okay.
The realms of general anesthesia versus regional.
So for me, it was more discomfort afterwards. But will we feel pain? Will people, when they get surgery, will they feel pain?
Yeah, that's a fantastic question. And probably the single best indicator for that would be how you experienced pain during your last surgery. So certainly if someone had like a minor laparoscopic procedure, you would expect, going home the same day, you would expect about 5 to 7 days recovery. So if that individual actually ended up having a 2 or 3 or 4 week recovery, you could probably expect that for any subsequent surgery. Alternatively, if someone had a high pain tolerance and they were out of the hospital an hour after surgery, back to work in 48 hours, your subsequent experience, your pain experience will probably be similar. Now, it's highly individual, but generally speaking, if your surgery is amenable to like keyhole incisions with the robot or laparoscopic, and if that's an option as opposed to an open incision, you're gonna have way less pain.
Okay. Will you remember your surgery? Because I don't remember mine. I remember walking to the hospital and that's it.
Yeah, so that's also highly individual, and it is largely due to the types of medications that are given just prior to going back to the operating room. There are drugs that are used for the purposes of putting you to sleep, but also have the side effect of forgetting, causing amnesia in that time period right around the surgery.
Okay.
People will remember being in pre-op holding, and then they'll remember being in post-op recovery, and they don't remember anything between. That's fairly typical.
And why did I know for a lot of us we faint at the sight of blood, but why do they have to draw blood from us twice?
So, that's a very good and a very common question, and it kind of goes into that category of painful but necessary, right?
Okay.
So we need to do a medical workup to evaluate if there's any risks that are specific to the individual that need to be mitigated prior to doing the surgery. And part of that is blood work, part of that is an EKG, part of that is a chest x-ray. But in your blood work, if we find something that we need to act on, we need a long enough runway so we can correct that prior to your surgery. So that's typically done maybe a month in advance. Mm-hmm. So your question, why do I then have to just get blood again the day before or the morning of? So your pre-op lab, all patients that are undergoing a major surgery and most minor surgeries need a blood test called a type and screen, okay, or an ABO, or basically just a blood type, okay? Now, most people would ask, well, wait a minute, I know my blood type, so why do I need that test? So what we're really looking for in that test is antibodies. Antibodies that would prevent you from getting a certain type of blood in the unlikely event that you needed a blood transfusion.
Oh, okay.
Okay, and now is the reward for sticking around. We're going to talk about the entire surgical process from the moment that you decide to have your surgery to the time that you come in for your second post-operative visit, and essentially you're free to do everything normal. And we'll do that right now. So all this begins with the surgeon and the patient deciding that the required treatment for their condition is to proceed with surgery. Now there's many types of surgeries and there's many different considerations and many indications for each surgery. So to simplify it, we're going to talk about one type of surgery and we're going to talk about a hysterectomy for fibroids. So prior to making the incision, you would have had a discussion with your surgeon about all of the treatment options, and probably you would have tried the conservative options, you would have tried medical therapies, and you would have discussed the alternative surgical options, including an ablation, a myomectomy. And if you've arrived at the decision that a hysterectomy is the best option, then you would discuss whether it would be vaginal, laparoscopic, abdominal, or an open incision. And you would want to make sure you're comfortable with your surgeon's choice. You'd want to make sure that they're very experienced in the route of surgery that they're suggesting that you have. And so in our case, we're going to talk about a robotic hysterectomy for the purpose of fibroids. So immediately after you and your surgeon together decide that hysterectomy surgery is in your best interest, you would need to complete a medical and a surgical workup. Now, a lot of this may have been done in the process of evaluating why you need the surgery in the first place, but they could include an ultrasound, could include an endometrial office biopsy from the surgical workup, and maybe bladder testing. It will also include a medical workup, including labs, blood work, and an EKG, and a chest x-ray in some circumstances. Now, for all these testings, you could get that done at your lab of choice, and we just want to make sure that we get all of those results prior to scheduling the surgery. Your next step would be to go to the surgical scheduler. You'll decide with your surgery scheduler the date of the surgery, and they will also contact your insurance company to verify and get an authorization for the procedure. Your surgery scheduler will also review your medical and surgical workup, and they'll go ahead and schedule any tests that are outstanding that need to be completed prior to the surgery. Your pre-op visit, the main purpose is to obtain what's called an informed consent. So you and your surgeon will discuss for this exact surgery that you're proceeding with, what are the benefits of the surgery, and then they're going to talk about all of the risks of surgery. Now, risks of complications are rare, but we need to talk about every possible thing that could happen just so you're informed and making sure that you are making an educated decision. Now, your pre-op visit is typically the day or two before your surgery, and you're going to receive instructions on what needs to take place between now and then. We're going to ask you to stop any medicines that can affect the ability to make blood clots in your body. So you're going to stop aspirin, you're going to stop Motrin, any blood thinners. We'll also ask you to take a booster and ensured calorie drink right before you go to bedtime so you have nutrition available to help you recover before, during, and after the surgery. We'll also discuss with you the process for recovery, the basic do's and don'ts. At the end of the pre-op visit, we'll give you your orders to get final blood work. Now, we've already had blood work done, so why do we need to do another set of blood work? Well, the answer is simple. So for any surgery, we need to know what your blood type is, and we need to know if there's any antibodies that would have a bad interaction in the unlikely event that you needed a blood transfusion. And for women of reproductive age, we always have to make sure that we get a negative pregnancy test right before the surgery. So typically, you'll take that order set and you'll proceed to the next step. You'll go to the pre-surgical testing. So in pre-surgical testing, you'll get any final testing done that you'll need the day before the surgery. So typically, this will just be a simple blood draw. From there, you'll also have an evaluation to look for any other medical issues that could come up during your surgery. So now you're ready for your surgery. You'll go home, you'll have a light dinner, you'll have a caloric drink right before bedtime. You may or may not take a medicine that helps us to color the urine so we can visualize the bladder during the surgery. And then you'll get a good night's rest. So you're going to get up very early on the day of surgery and you'll go into the hospital, the Department of Registration. At that point, they'll finish any final paperwork and then they'll walk you over to the pre-op holding area. You're going to arrive in your pre-op holding area anywhere from 90 minutes to 3 hours prior to your scheduled surgery. Now, the reason this is important is there's some unpredictability that can happen during a surgery, and we just need to be able to have enough time to accommodate that. So in the pre-op holding area, you'll be asked to take all your clothing off and get into a standard hospital gown. The nurse is going to take you into your own pre-op room. They're going to draw some blood. They're going to start an IV. They're going to give you some medications, and they're going to ask any questions that are important for the surgery that you're having. You'll also get a visit from the operating room nurse, the anesthesiologist, and the surgeon. Please be patient. You can have a lot of the same questions asked over and over again, but we have to do that to reconcile and make sure that we don't miss anything. Just before you go back to the OR nurse is going to give you some anesthetic medicine, and then we'll roll you back to the operating room. Now that's pretty much all anybody remembers, because some of the meds that are used for anesthesia cause amnesia, and you tend to forget the process of the surgery itself. In fact, most patients, including myself, remember going to the operating room and then waking up in the recovery. The surgery may have taken 30 minutes or 4 hours, and all you really remember is going to sleep and waking up, and so for you it seems like just a few minutes. In the recovery room nurse is going to help you wean off from the anesthesia, give you any oxygen or any other medicines that you need. They'll continuously monitor your vital signs, and once you've met all the criteria for that surgery, such as being able to eat and drink, walk around, typically being able to urinate, once you've done these activities and you've met those criteria, then you'll be able to be discharged home. At home, you do not want to be bed-bound. You want to be ambulatory so that you can reduce your risk of blood clotting, but you're also going to want to take it easy. Typically, we'll see you 1 to 2 weeks after the surgery. Now, at this point, 95% of major complications that could occur would have already occurred, and so we're seeing you at that point where most of the healing is taking place. And for a lot of people, that's the point where you can start going back to work, particularly if you've had a minimally invasive robotic surgery. Typically, we're going to see you back for an 8-week follow-up. Now, at 8 weeks, 99% of the healing has taken place. So pretty much you can get back to all normal activities. Understanding that some people heal different, some people are going to take a little bit longer than that. And that's it. That's the entire surgical spectrum from your decision to have surgery to your second postoperative recovery. Hopefully you found this video helpful in relieving some anxiety that might come around the surgical process. Make sure you hit the like button and make sure you hit subscribe. Make sure you share the video with your friends. We also have many valuable videos that you can look at in our library, like this one here. Again, thanks a lot, and we'll see you next time.